Hi, this is Kristen Group with EstheCeuticals, and today what we're going to be doing is a fractional 1540 nanometer treatment, long name, for a little bit of anti-aging on our client's décolleté, otherwise known as chest. Now, what today is really about is to showcase a couple of products that EstheCeuticals has come out with to enhance fractional treatments. As we know, fractional, whether it's non-ablative or ablative, puts little microchannels down into the skin. Once those microchannels are open, it is the perfect opportunity to put products in that can, one, help with the healing of the skin, but also there's a very large molecule called native hyaluronic acid. And it is about 1 to 1.5 million Daltons. Daltons is a molecular weight. In order to penetrate the epidermis, something has to be underneath 500 Daltons. Now, obviously, 1 to 1.5 million is not under 500, so there's no way hyaluronic acid is actually going to go into the epidermis. Now, at EstheCeuticals, we only use native hyaluronic acid, otherwise known as HA. The reason being is there's something called low molecular weight hyaluronic acid. And what that is the companies that are using that in their products, somebody has chopped up the molecule into smaller pieces. And research has shown that low molecular weight HA actually can act as an inflammatory in the tissue, and that's not what we're trying to do. So at EstheCeuticals, we made the decision to only use native HA. It is more expensive, but it's better for the body. Native HA would be like Restylane Juvederm, one of the products that companies use for fillers. So once those microchannels are actually open, it's a perfect opportunity to push hyaluronic acid into the skin, help increase the moisture content of it. But also we push in green tea and some other things like copper peptides to really help not only in collagen synthesis, which is one of the things we're trying to do, but also help in the healing of the skin. So I'm going to do a fractional treatment on our client's chest, and we're going to do these in a couple little parts because we're going to do some photography at the end to see how fast the erythema, which is the redness, goes away. So after we put our recovery treatment spray on the skin, then we also have a recovery cream that we sell to our clients to help with the irritation of the skin, help with the redness of the skin, because a lot of times fractionals will stay red, depending on the person, for up to 2 days, and depending on the strength of the treatment. So it uses different things to help hydrate the skin and to help heal the skin, and it's a wonderful soothing treatment after a fractional treatment or after any type of skin irritation. So my client has her goggles on. I'm going to get my gloves on, get my machine turned on, and we're going to go ahead and start the treatment. And by the way, we don't do any products on the skin while we're doing the treatment because this handpiece is attracted to water. So if I put any product on the skin, that's what's going to take the absorption. So we're going to do it over the skin dry, and then we're going to put our EstheCeuticals products on. So we will be right back. Okay, so what I am going to be doing is a fractional treatment, and I am using my 15 millimeter handpiece, which is a pretty big handpiece for this treatment. How you do this treatment itself is you overlap 50% side to side and 25% or 20% up and down or in between rows. And we're going to do a couple of passes on her skin. You're going to start seeing her skin get a little bit pink, and that is okay. And how are you doing? T-spline. So why would we do a fractional treatment? There's different reasons. Could be for anti-aging, could be for acne scars, could be for melasma. It's one of the few laser treatments out there that will actually help with melasma. Could be for skin tone and texture. There's several different reasons. Now you see the difference here and right here. So I'm going to go over to my next section. And today what it's really about is not just our client, as she said, she is the most important part, and that's true. It's about product use and usage. products with actual treatments to increase the efficacy of the treatments, but also decrease some of the damage, or some of the collateral damage, as I like to call it, which would be what's being caused by the treatment. This treatment causes a lot of erythema in the skin. It causes a lot of heat in the skin and sometimes irritation. So what EstheCeuticals, my company, has done is create products that help to take out the irritation, help with the collagen synthesis, because we're all trying to create more collagen, and to increase the healing, or to decrease the healing time. My machine's a little bit closer to me. So there's certain ingredients out there that help with that, and the ingredients have peer-reviewed research, and things like copper peptide, hyaluronic acid, green tea, niacinamide, which is a B3. There's lots of different products out there, ingredients, that when used properly can really help change how your treatment outcome is, or what your experience of your client is. So I am almost done with this treatment. And then we're going to start with our products. How are you doing? Let's go. We are back after our fractional treatment, and a couple of things. One, right behind me is a time-lapse camera, and we are doing some photography to see how fast the erythema leaves our client's skin. I've done her treatment, but one of the first things I'm going to do is I'm changing out my gloves. You want to apply products with clean gloves. Now, some people might say you could put the products on a 4x4, but the 4x4 is going to absorb a lot of the product, and I want it to go onto her skin. So what I'm going to first use is the EstheCeuticals Laser Ease Fractional Recovery Spray. So I'm just going to get a little bit and put it in my hands, and I'm actually only going to use it on half of her chest. So I'm going to pat it into the skin, and again, this product is a little bit brownish, kind of a orangey color. It goes into the skin. What I am doing with it is to be able to push the products, which the main ingredients in this product is the hyaluronic acid, the copper peptide, and green tea, and alpha-lipoic acid. So these are all things that help to heal the skin, help with collagen synthesis. We want to take advantage of these microchannels that we've created. Once they're open, it's a great opportunity to put something in that you want to go in. Let's say I was doing a treatment for melasma, okay? Pregnancy mask, sometimes caused by birth control pills or hormone replacement therapy, or even thyroid issues. If I was doing a fractional treatment for that condition, I would use my brightening cream, which is right back here. A combination of kojic acid, licorice root, niacinamide, all different brighteners. I don't use any hydroquinone. I would put that on the skin afterwards, trying to get this product to go into those microchannels, okay, to help lessen the pigmentation. So you have a couple of options. We are doing anti-aging, so I use the fractional recovery spray. Now, once that is absorbed Can you feel any difference between one side or the other?
This side definitely feels like it's cooling down.
Okay, so she said the right side feels like it's cooling down. That's great. I'm going to put on top of it our Fractional Recovery Cream. And this is a product that my good friend that's laying here has used with other skin irritations that she's had from topical prescription drugs that are for skin and for skin cancers. It really, was it Piccata? Piccata is like an Effudex or an Aldera. It really irritates the skin, and what we have found is compliancy may go down. So she was using this product after that and really noticed a difference in the hydration of her skin and the itchiness of the skin, that it was lessened. So I think this is a wonderful product for skin irritations. It's got a lot of beneficial ingredients in it, which are going to be the sea kelp, ceramides, hyaluronic acid, copper peptide, again, epidermal growth factor. So things that are going to help with the cell's turnover, things that are going to help with the collagen synthesis, and things that are going to help with the irritation and the inflammation in the skin. So we've got her recovery cream on, and we've got the treatment spray on. These are both with the EstheCeuticals Laser Ease line. Just like all of our other Laser Ease products, these are not machine specific, they are treatment specific. So our Fractional Recovery Cream and our Fractional Treatment Spray will work with any fractional machine, ablative or non-ablative. And by the way, one of the things that people are doing after an ablative treatment is also using a higher concentration of vitamin C. So we do have that product also if that's what your office is doing in its protocol. Now, what do you think of how it's feeling one side versus the other?
The right side feels normal now, and the left side feels warm still.
Does it feel like it's itchy or anything?
It kind of feels like a sunburn on the left side.
And you know, I'm going to make her sit like this for a little bit because I'm not the nicest friend in the world. And I want to see with the cameras what this is doing. If I was like the really nice person, I'd probably put it on the whole area. And if she was just my client coming in and we weren't filming this, that's what I would do, is I would put the product on the whole area. Now, retailing, what can you do with this? You can retail the recovery cream. The treatment spray, could you use it for retail? Yes, you could. Probably not going to be though. It's probably going to be just a back bar item. But the recovery cream is definitely something that you want to send home with your client to help with the irritation. What I found with, again, fractional treatments is sometimes the skin will stay irritated and red for up to 2 days. One patient I had years ago, she stayed red for about 5 days. So what I usually have them do is apply the recovery cream, a fractional recovery cream, 2 times a day, usually when they, in the morning. Sometimes it does make the makeup go on a little bit, but most of the time with a fractional you aren't using makeup, so it's still okay. And then before bedtime, and it's really helping the hydration. And one thing also I noticed with after a fractional treatment is about 3 days post, the skin gets really itchy. Okay, so it tends to, when it's healing, to become kind of itchy. I know when I've done stretch marks on my hips and stuff, I just want to claw them off. Basically at that point, the only choice that you have is a hydrocortisone cream. Well, this gives your client another option. So when they put this cream on, it feels very soothing, very hydrating, and again, it's really good for their skin. So we're going to let the camera go just a little bit more. She's still erythemic on both sides, but again, it very well may be that she is, because her skin does tend to get pretty red. But I notice, you know, from her point of view, that the irritation's coming down, the heat feels like it's coming down, and that's always a good sign. So this is Chris Group with EstheCeuticals, and thank you so much for viewing our Fractional 1540 treatment with our EstheCeuticals Laser Ease Fractional Treatment Spray and our EstheCeuticals Laser Ease Fractional Recovery Cream. Thanks so much.